What is common between you and these cricket players? The answer is shoulder pain. So let's uncover what happens and how to control it. I'm Dr. Muhammad Ali and this is my channel. Before we fix the shoulder pain, let's meet the key players. Your shoulder has a complicated structure. First, ball and socket joint. Your arm bone is called humerus and the shoulder blade called scapula. Humerus and scapula fit to each other like a socket and ball. This great design gives a great range of motion, but unfortunately, it's less stable. Number 2, the rotator cuff. The rotator cuff is a set of 4 small muscles: supraspinatus, infraspinatus, subscapularis, and teres minor. Don't care about the names. I know it's a little bit difficult. This set of muscles hold the ball in the socket as we mentioned before. Number 3, bursa. Bursa is a tiny fluid-filled structure that acts like a cushion to prevent the friction between bones and the muscle tendons in the shoulder. Number 4, labrum. It's a rubbery rim around the socket of shoulder. This rim deepens the socket of the shoulder to give it more stability. Stop this video and write in the comments what could be the most common structure that got injured in the baseball and the cricket players. What is the most common cause of shoulder pain? Before talking about the common causes of shoulder pain, I'd like to say that it's not painful if you press like, share, or subscribe. Why does this clever design fail sometimes? The first reason could be the rotator cuff tear or inflammation. Imagine a rope that rubs against edge or a rough surface. This rope will fray with time. The same happens to the ligaments of the rotator cuff muscles. That usually happens during lifting heavy objects, especially when they are over the head, like the repetitive motion that gym players do, especially in the shoulder day, and throwers like baseball and cricket players. Then, this is one of the most common injuries among the cricket players and baseball players. Second, the impingement syndrome. Normally, there is a space between the tendons of the rotator cuff muscles and the bony structure. This space is filled with bursa that we mentioned before. When this space becomes narrow, it causes compression on the rotator cuff tendons. That causes inflammation and pain, and that's what we call impingement syndrome. Number 3, frozen shoulder. Joint inflammation due to any cause makes the joint capsule stiff like dried glue. This is common usually after arm injury. The patient in this situation suffers from pain and limited mobility of the shoulder joint. Number 4, arthritis. The articulating surfaces of the joint are covered with cartilage. This cartilage prevents the friction between the bony ends of the joint. Due to overuse, there is wear and tear of this cartilage. That leads to exposure of the bony ends. Then the friction between these exposed bony ends will be very painful. That limits the motion of the joint due to the pain. That's what we call arthritis. This patient suffers from pain and limited range of motion. So, which one sounds like your pain? Now the question is, who is at risk? Anyone can suffer from shoulder pain, but these groups are at high risk due to their daily habits. First, desk workers and students. Sitting for hours with rounded shoulder overstretches the rotator cuff tendons. It causes what we call upper crossed syndrome. It's a combination between weakness of the upper back and tightness of the chest muscles that leads to dull aching pain between shoulder blades and difficulty reaching behind the back. Number 2, the overhead athletes. The repetitive movement of the shoulder, like in swimming, throwing pole, or shoulder exercise in the gym. This repetitive movement causes micro-injury to the shoulder labrum that may cause what we call dead arm syndrome. Dead arm syndrome occurs when shoulder ligaments loosen too much or get torn. It leads to popping sensation and sharp pain during shoulder movement. Number 3, the manual laborers. Constant arm above head work compresses the bursa that we mentioned a few minutes ago. Moreover, lifting a heavy object leads to shear of the AC joint. This is the joint where the collarbone meets the scapula. The result in this situation will be swelling of the shoulder joint and night pain. Number 4, postmenopausal women. When the woman has no more menses, that's what we call postmenopause. Estrogen level drops dramatically after menopause. That weakens the tendon collagen. Moreover, after menopause, there is calcium deposition in the tendons, and that feels like tiny bony spikes in the shoulder. This type of patient suffers from sudden sharp pain of the shoulder while doing some activities like combing her hair. Number 5, the gym players. The bench press with heavy weight jams at the head of the humerus forward in the shoulder joint. Moreover, the lat pull down behind the neck shears the shoulder labrum. That leads to clicking sound and feeling of instability of the shoulder. So tell me in the comments, which group are you in? Then, what are the red flags? See the doctor immediately if you have these symptoms. The last one is the most critical one, and being aware of it can be a life-saving. If you have severe shoulder pain, especially in the night that wakes you up, inability to lift your arm at all may be a sign of tendon cut, numbness and tingling of your arm, as it could be a nerve injury or nerve compression, swelling of the shoulder joint with fever. It could be a sign of infection of the shoulder joint. Number 5 is the most critical one. It is specific for the left shoulder. If you have left shoulder pain accompanied by chest pain or chest discomfort, call the ambulance and seek medical advice urgently, because it could be a heart attack. Now, how to quickly fix the shoulder pain? First, the rule of 20 minutes rescue. This is a combination between ice compression and the elevation of the arm. 15 minutes for ice packs compression on the shoulder, but beware, don't apply the ice directly on the skin, because it may lead to skin burn. Yes, ice can cause a skin burn. So put the ice in a piece of cloth before applying it on the skin. Then use a pillow to elevate your arm above the heart level for 5 minutes. This will reduce the swelling of the shoulder joint. Number 2, the hammock trick. You can use arm sling to offload the weight on your shoulder. This is effective for sharp pain that occurs due to rotator cuff tear. In this case, limitation of movement by the sling is very effective. Number 3, the pain-free sleeping positions. If you sleep on your side, hug a firm pillow to prevent your arm from collapsing inwards. But if you are a back sleeper, use a small pillow below your elbow to keep your shoulder slightly bent. Now, for the long-term repair, we have many techniques to fix shoulder pain for the long term. First, 30-30 method. Every 30 minutes, roll back your shoulder 5 times. Then, gently squeeze shoulder blades for 30 seconds. Number 2, movement retraining. You have to be cautious about the position of your shoulder while doing certain movements. For example, usually lead with your thumb. That means if you are trying to reach overhead, usually make the hand in this position and move up, not in this position. Moreover, for lifting heavy objects, keep the object near your body, because this will add more load on your joint. Number 3, adjustment of the workplace environment. For those people who use the PC and stay for a long time on the desk, adjust the height of the keyboard. Also, you can adjust the screen at your eye level. These adjustments may take some time to relieve your pain, but will help on the long run. It's also very important to see the doctor or physiotherapist if there is no improvement. And always remember, early treatment equals faster recovery. And then, like, share, subscribe, and leave me a comment about your joint pain. See you.